If you have diabetes, you'll face increased cost of living. For instance, you'll need to make at least 2 to 4 annual visits to your healthcare provider, and possibly a visit to an endocrinologist as well. In the case of complications, you'll need to see other specialists, such as a podiatrist or ophthalmologist. No matter what type of diabetes you have, you'll need to purchase and use a blood glucose monitor and the strips that go with it. Strips can be a significant expense because they must be continually replaced. Depending on how often you need to test, the expenses can vary. Depending on your diabetes, you might also need to take pills, insulin, or both as part of your treatment. While coverage varies from state to state, in many states, individual health coverage may be denied to people with chronic diseases, including diabetes. In some states, having diabetes doesn't disqualify you from getting individual health insurance, but insurance companies may charge you a higher premium based on your condition. All of these factors can become quite costly for a person living with diabetes, but we have some solutions that may help ease some of the financial burden. Let's start by discussing some options to help with insurance cost and gaining coverage. The new federal healthcare legislation passed in 2010, known as the Patient Protection and Affordable Care Act, is expected to help make insurance coverage more accessible and affordable for people with diabetes. Under the new law, starting in 2014, health insurance companies will not be allowed to deny you coverage because of a pre-existing condition, like diabetes, or charge you higher premiums. Depending on your income level, you may also receive subsidies to pay the insurance premiums. Until then, you have several options. If you've been uninsured for at least 6 months and have been denied insurance because of a pre-existing condition, you can buy health insurance from the new pre-existing condition insurance plan, administered by the government. Depending on the state you live in, you may also have access to state-sponsored high-risk pool programs, or to private insurance regulated by community rate restrictions. There are also insurer of last resort programs in some states where a single provider offers insurance to people with pre-existing conditions who cannot get insurance elsewhere. You can find out which options are available to you and how they compare by going to healthcare.gov. Additional assistance may be available through Medicare for individuals age 65 and older, or Medicaid for lower income individuals who do not have insurance. If you use insulin, Medicare will reimburse you for 100 diabetes monitor strips a month. If you do not take insulin, Medicare will reimburse you for 100 strips every 3 months. To make sure you get the right number of strips, Medicare requires your doctor to write on the prescription form the number of times you have to test your blood sugar every day. If you receive Medicaid, check your state government's website for information on Medicaid benefits in your state. If your employer offers health insurance, find out if you can receive coverage under that plan. Employer policies are often more affordable and more comprehensive than individual policies, regardless of health status. Talk with your employer's benefits coordinator about all of the coverage choices available to you, and also make sure to take advantage of any preventative care programs offered by your employer, such as company fitness programs and healthcare fairs. If you have insurance through your employer and are laid off, retire, or change jobs, COBRA, a federal program, allows you to be covered under your employer's policy for 18 months after you leave your job, though you may need to pay part of the premium covered by your employer. In most circumstances, you must sign up for COBRA within 60 days after the coverage provided by your employer ends. If you are on insurance, whether it's an individual plan or an employer plan, call your insurance company and speak with your managed care representative or coordinator to build a relationship with them so you can be clear about your benefits before you have a problem.